Dawn Best fought hard to get her mother into the Gerwin Jewish Nursing Home on New York's Long Island. And at 83, Carolyn Best was happy and thriving.
My mother was doing great. We were thrilled.
But when the state began moving COVID-19 patients into Gerwin last March, family access was cut off, and everything changed.
And within 3 weeks of the COVID patients being forced into her nursing home, she was dead.
Records show she was dehydrated.
She did not die a natural death. She did not get the COVID. The nursing home was overwhelmed.
The coronavirus pandemic has hit older adults especially hard. More than 90,000 of America's long-term care residents have succumbed to the disease. But experts say short staffing, made worse by the pandemic, and the inability of relatives to check on their loved ones, have led to a second, less visible wave of death.
Nursing homes are staffed in the best of circumstances to provide routine services to the people who live there.
In a study for the Associated Press, Kay found more than 40,000 so-called excess deaths in long-term care facilities since March. For every 2 COVID-19 victims in long-term care, another died prematurely of other causes. Some death certificates cite simply a failure to thrive. Advocate Lori Smetanka says residents cut off from family and each other are lonely and anxious.
And it's causing a lot of them to talk about losing the will to live. So that's taken just as much of a toll as COVID has on residents.
We've been praying for you.
Advocates have been flooded with reports of alleged neglect, of residents left to deteriorate in their rooms. Barbara Leek Watkins says if there's anything her father learned in the Army, it was to drink lots and lots of fluid.
He always taught my sisters that when it comes to hydrating yourself. And he loves water.
So when Alex Leek Jr. collapsed in his room at the Brookdale Northwest Assisted Living Facility in mid-July, the doctor's assessment was confusing.
He said, look like your dad is going into kidney failure because of dehydration and laying on the floor. He looks like, he said, for hours.
Leek died a month later. He was 87. Brookdale Senior Living said it couldn't comment on individual cases, but that, quote, the health, happiness, and well-being of each of our residents will always be our priority. David Gifford of the American Healthcare Association says staffing hours have actually increased during the pandemic. He called case findings speculation.
There have been some really sad and disturbing stories that have come out, but we have not seen that widespread.
Gerwin said its staff made heroic efforts to care for residents, at great risk to themselves and their families. Dawn Best doesn't blame the nursing home staff. She does blame politicians and public officials who don't take the pandemic seriously.
It is not political. This is as personal as you get to us. You killed our parents.
She thinks society failed her mother.
She didn't deserve to die this way. She deserved to be taken care of.
Alan Breed, Associated Press.